Okay, so from those digital x-rays, we import into our computer system that does a digital analysis. This is one of the state-of-the-art analysis for low back pain, but more specifically diving into the problem behind your pain. What you're seeing here is a side view of the low back and a front view of the low back. The science has established a normal position. As I mentioned before, there are a lot of normals in healthcare, like a normal blood pressure, a normal blood labs, normal height and weight that's desirable, and like that, this is the desirable position for the low back. Now, this is an ideal position, but we can strive for this as a clinical outcome if somebody does desire. More specifically, if we go back, this abnormal position, this red dash line you can see is off the green line, is actually what's putting pressure on pain-sensitive tissues, like discs, like muscles that surround this area, and the vital nerves that come out of each and every one of these areas. It's a little bit more evident to see on a front view. Green line is the normal, upright, healthy position, and the red line in this patient's condition is actually where this person's at. So we're looking at this patient. This patient is shifted off to the side, and this is what we know in the literature will cause a lot of degenerative disc, degenerative joint issues, but bottom line, this causes a significant amount of pain. So one of the greatest things that we can bring to the table when we're doing an analysis like this is truly, not only on top of our orthopedic and neurological testing, the x-rays allow us to see a structural problem that will be causing pain. From this, we can actually set up a comprehensive treatment program that's going to address the problem instead of just addressing the pain. Meaning, if we can address the problem, move the spine into a healthier position, the pain will follow. I mean, the pain will go away, and then you're getting an objective measure down the road to see how much that problem has changed. Now, some of the questions that we get, is this really a detailed analysis? Yes, it is. It's not just lines on an x-ray. Actually, a PhD in finite mathematical modeling came up with this model by the name of Don Harrison, who published this in the top orthopedic journal in the world called Spine. So we know that this is an accurate analysis down to 1/10 of a millimeter and 1/10 of a degree. So not only can we say, hey, this is the potential cause of your problem, but when you make some changes, we know that when we measure this again, it's going to be very accurate. And a lot of people have walked out of this office with amazing changes after therapies, custom fit therapies, to be able to see these changes and go on to truly maintenance care where they don't need to be in the office as often as they once were.